Anna was diagnosed with type 1 diabetes when she was 3 years old. They had finally checked her blood sugar, and it was at 500. She was immediately sent down to Children's Hospital, where we spent 2 days getting her levels safe, and then another day at the Barbra Davis Center, where they taught us everything they could in as short of a period of time so that we could bring her home and start our new adventure with her.
I think the Barbra Davis Center has done a lot to change kids' lives. Whenever I meet colleagues from around the world, they know the Barbra Davis Center, and they know that the work that was started, over 40 years ago by Dr. Chase is being continued by the doctors here now in terms of advancing technologies, advancing therapies, and really revolutionizing care, research, and the lives of children with type 1 diabetes.
It's hard to have one kid with diabetes, and two would be very hard. So we always said, well, at least Ellie will never get it. And then she did.
Ellie had tested positive for 4 type 1 antibodies.
There's a period of kind of grieving and anger and then acceptance and a little bit of reassurance that, well, we've gone through so much with Anna, at least we have a roadmap as far as what's going to happen, and we've got a great support system and one of the best facilities in the country.
My favorite thing to do at the BDC is see my doctors. My sister Anna is kind and brave. Do finger pokes. I actually do it by myself. I poke my fingers by myself too.
Type 1 diabetes, as we all know, is a community disease. It doesn't just impact the child themselves. It impacts their parents very heavily. It impacts all the adults that provide care for them. It impacts their siblings.
From the moment we stepped foot in the door, that first day we walked out of the hospital, we have been treated like part of their family. We have been with the same team for the past 3 years.
By improving the life of the child with type 1 diabetes, we're also able to improve the worry and stress of the parents.
They support us through everything. They make us feel like every time we come in, Anna's going to be okay. And they have been our greatest support team throughout this whole journey.
I like to believe we help make the life better for the entire family, the extended family, the school, and the whole ecosystem.
My favorite thing about having diabetes is that I get to do everything that everyone else does, and I get to have those snacks too.
We are so grateful for everyone that donates to the Children's Diabetes Foundation.
And it just goes so far and helps so many people in so many ways.
We're able to provide a level of care that is the way we think children should be receiving care for type 1 diabetes.
It allows them to empower patients, educate families, and provide research that without it, we wouldn't be making the advances that we are to help my girls and all the other kids living with type 1.